How does aging affect our teeth?
Certain things will happen and do happen to almost everyone's aging teeth. One is the enamel gets thinner. You're brushing your teeth for 40 years, you're going to wear some enamel off. If you're chewing foods, if you eat a lot of grains, you're going to grind a lot of enamel off the tops of your teeth.
Does dental care change as we age?
As we age, we lose some of our youth and our ability to combat disease. Our immune system is less effective. Our digestive system is less effective. So certainly it becomes more and more important as we get older to do the proper things that we can do to promote health in our mouths and our systems.
What is dry mouth?
Dry mouth is very common in elderly people, over 65, let's say, that category. There's a wide variety of medications that have dry mouth as a side effect. And this compromises the health of the tissues. When the patient's ability to produce saliva is impaired, they're much more prone to tooth decay. Oftentimes a physician can change medication that will help this. The patient can do things for themselves, like just prophylactically keep a glass of water at hand all the time and just take a sip, slosh it around in your mouth, and keep your mouth wet during the day. If you're retired and you're at home, you can usually do this.
What is the most common problem of aging teeth?
The biggest cause of tooth loss for people as they get older is gum disease. And this is unnecessary tooth loss. And most of it is because it's either unidentified or untreated. So if you're not going for checkups, you're not going to be aware that you have it. And where tooth decay hurts if it gets too deep and you have to go because you want to sleep at night, gum disease doesn't hurt most of the time until it's in the final stages, and then it's too late.
What is the effect of smoking on dental health?
When I got out of dental school, we worried about smoking because it stained the teeth. Now we know it's far more serious than that. You know, it compromises the tissues around the teeth, their ability to, for blood circulation, it diminishes blood circulation. It's definitely a contributing factor for gum disease. In fact, nowadays, if you're interested in getting an implant, that's one of the negative factors for discouraging you from getting an implant, is if you're a smoker.
How can we protect our aging teeth?
The statistics are pretty glaring. I mean, people lose a lot of teeth that they don't need to lose, and if they had just gotten to it early, it wouldn't have happened. If you get to a good comprehensive dentist, have him keep track of you and have him keep you up to date on what you can do to prevent problems, you're much better off.
For more information on caring for your aging teeth, go to the Adults Over 60 page at the website of the American Dental Association.